It is well established that adults with IDD are more frequently affected throughout their life by certain chronic diseases such as constipation more than their peers without disabilities. Constipation is a condition that is very prevalent and is reported in up to 40% of individuals with intellectual and developmental disabilities. Constipation in this population is mostly due to neuromuscular abnormalities, immobility, suboptimal diet, and medication side effects. History taking with this population is frequently limited in adults with IDD due to communication barriers that often leads to a misdiagnosis of constipation and diagnostic overshadowing. It is thought that 50 to 90% of patients with gastrointestinal issues who required treatment have suffered from at least one mental health condition, of which depression and anxiety are the most common, showing that gastrointestinal issues and mental health conditions often co-occur. Research shows that psychological factors are well recognized to affect gut physiology, impact the severity of symptoms, and influence outcomes following treatment, which support the need for a biopsychosocial approach to management of gastrointestinal disorder. Treatment in patients with IDD require an individualized approach to reduce the constipation and its associated health complications. Our goal in START is to assess for these gastrointestinal issues like constipation on a biopsychosocial level in order to provide holistic treatment. Over the last quarter, Texas START had 11 patients reporting gastrointestinal issues. Brian, a 10-year-old African-American male, is a great example of how START and our multidisciplinary team assisted with his GI issues. Brian's psychiatric diagnosis is autism, childhood social anxiety disorder, ADHD, dyslexia, selective mutism, and separation anxiety. He has moderate IDD. His medical issues are concerns about pica. Stressors are bullying, lack of support from school, chaos in the house, and panic attacks. GI symptoms that were reported by Brian were constipation, stomach aches, lack of appetite, poor diet due to sensory issues, anxiety-related stomach issues. With the utilization of START and the multidisciplinary team, recommendations were made. START and PCP recommendations for diet and stomach aches were milk of magnesia and to change diet by adding vitamins and food substitutions such as vegetables. Occupational therapist recommendations for pica were utilizing bubblegum or Chulery to replace paper, reducing general anxiety stressors by adding a behavior plan to make meal times more fun, using social stories regarding school and making friends to reduce anxiety, anti-anxiety breathing exercises, and dancing out worries in order to reduce pica. Psychiatrist recommendations for constipation was a review of medication to see if it was a factor in constipation. Add vitamins and alternative options were discussed. Changing diet to offer more fiber was also discussed. Psychologist recommendations for lack of appetite was creating a meal plan for making dinner and family time to encourage eating and using social stories to explain the importance of healthy meals. In conclusion, START and the multidisciplinary team's recommendations for Brian were proven successful and a reduction in his GI issues and anxiety were attained.